Today, we are uncovering how yoga and neuroscience are rewriting the script of healing.
I'm Jonathan. Hello, everyone. I'm a neurologist in New York City. I also am a student of yoga. I've been practicing yoga way longer than I've been in medicine.
Why is it that a lot of people with the modern science background negate the benefits of yoga?
I think everyone might know who Steve Jobs is. He was the founder of Apple, was diagnosed with pancreatic cancer. And this isn't specific to yoga, but he was diagnosed with pancreatic cancer and refused medical treatment. We know that chemotherapy surgery prolongs people's lives when they have cancer. Well, he's showing that if they do yoga on top of that, that prolongs their life further. Because it's really the brain that controls all of these glands.
A lot of the triggers around PCOS are because of the stress.
So it's really a hormonal disease. They also have changes in fertility. So around age 35, a woman's fertility really starts to decline.
Listeners, imagine this. You have just woken up from a deep sleep, and for a fleeting moment, your mind is at complete peace. No stress, no anxiety, no pain. Wouldn't that be something we all look forward to? Now, what if I told you that a 5,000-year-old practice could help you achieve this state of balance and healing, not just in sleep, but in everyday life? Welcome to another episode of We Are Listening, the podcast dedicated to bridging the gap between wellness seekers and wellness providers. I'm your host, Pulkit Garg, founder of Anya Wellness. And today we are uncovering how yoga and neuroscience are rewriting the script of healing. Whether it is restoring brain function after surgery, regulating hormonal imbalances, or enhancing reproductive health, yoga is more than just a movement, it's a science of transformation. Welcome, Jonathan.
Thank you so much for having me, Pulkit. It's an honor to be here.
Pleasure is all mine, Jonathan. And reason I didn't introduce you, I guess I will be short of words, so I thought I will give you the opportunity to introduce yourself to our audience.
Sure, I'm happy to. So I'm Jonathan. Hello, everyone. I'm a neurologist in New York City, which means that I'm a medical doctor that specializes in brain, spine, and nerve conditions. I actually subspecialize in a technique called intraoperative monitoring, where I try to prevent injuries during surgeries. And I also am a student of yoga. I've been practicing yoga way longer than I've been in medicine. I started yoga as a teenager, and I grew up kind of in two different lanes. I was in the yoga world, constantly doing my practice, reading books about yoga, the Bhagavad Gita, the Yoga Sutras, and then at the same time reading books about science, learning about neuroscience. And I always felt sort of like an outcast in both worlds. I felt like in the yoga world, there was a lot of criticism of science and medicine. And in the medicine world, there was a lot of criticism of yoga and other non-traditional methods. And so I was sort of I don't know, stuck between these two worlds until I started reading scientific papers about yoga. And that's when I realized that there's an enormous amount of evidence out there about how yoga affects health, the brain, the nervous system, cognitive functioning, and so much more. And so I started hosting events about yoga. And these events have evolved into this online conference, the Neuroscience and Yoga Conference, where researchers and yoga teachers from all over the world come together and share the actual science of how yoga affects the brain. And so this has become one of my main passion projects. It's something I'm super excited about, and I love talking about, thinking about, sharing the science of yoga.
Amazing, amazing, Jonathan. Um, you're amongst those one of very few modern age doctors who have been, advocating the science of yoga out there or natural healing for that matter. And I really, really appreciate it because for me, utopia in the medical world is something where natural healing and modern science can go hand in hand. And, if possible, we can have Ayurveda and yoga at the forefront for the preventive healthcare and modern medicine coming in for curative as well as emergencies. That's utopia for me. And I really look forward to the day when this becomes possible for the common people out there. What are your thoughts on this?
Yeah, so I always thought that I think one of the reasons I felt like an outcast in medicine was like, oh, I must be alone in this. No other doctors or researcher must be interested in this. But I actually think the opposite now. I think a lot of people hold that view that you just shared, which is that uh, for chronic lifestyle conditions, interventions like yoga are effective and should be included. And the research is what's really convincing people. This is what changes minds. So it's at a point, at least in the United States, where I live, where yoga is in the national guidelines for four different conditions. And those are back pain, cancer, migraines, and eating disorders. And so what that means is that because of the research that has been done, it's included in all of the, the guidelines are basically what make it out to doctors so that it can inform their clinical decision making. And so yoga is in those documents. And so, yeah, I think what the utopia you're describing is actually happening. And for me, it really hit me when I was talking to my mentor, who's one of my favorite people. She's been my mentor since I was a teenager, and she's an ICU doctor. And I was terrified to tell her about my, interest in yoga and the what I was doing because I thought she would see it as, hippy dippy, not really evidence based. And when I did finally tell her about it one day, she was so excited. She thought it was so cool, and that's when my mind totally changed. I was like, okay, this all the ideas that people don't want to hear about this came from me, my own kind of like obstacles in my mind. And so, yeah, I really think people want to hear about this and are willing to incorporate this.
That's amazing. That's amazing, Jonathan. Something I recently came across an Ayurvedic doctor sharing his case study where he helped a brain stroke patient recover 70% within 40 days of, having that brain stroke after the modern science doctors had given up on the patient. They were like, we cannot do anything more. And that's where this Ayurvedic doctor stepped in. Did both were very close friends, and within 14 days, or if I don't remember the time period exactly, was it 14 days or a whole month, but now the person is 70% recovered, started walking again, and the paralysis is reducing slowly and steadily with time. The patient is recovering where modern science just gave up. So there been instances in your life, and I'm going to come back to the 4 points that you just shared, because two out of those 4 points I do understand, where yoga can definitely play a very crucial role: back pain and migraine, because this is something I've myself experienced. But yeah, for the other two I'm going to be discussing. But yes, but before that, what are your thoughts on the case study that I just shared?
So it's hard for me to comment specifically. Sometimes what we talk about is like the natural history for a disease. So like how does a disease play out if you do nothing at all? And
Hmm.
it's always good to compare our treatments to the natural history of the disease. And so stroke in general, believe it or not, I know this is going to sound surprising to people, but people get better. So as long as people are making, doing the activities that are difficult, trying to relearn how to walk, trying to relearn how to do the abilities that they've lost, they do get better. It takes time. It takes weeks to months to even a year. But the natural history of stroke is that people get better. And I think, when I hear that the medical system gave up on the patient, I think that was the problem. I think you know, if if that patient was going to rehab, even if it wasn't yoga, that patient also would still get better. Um, and so I've seen many, many stroke patients over my life, and I've seen it so many times where, they look really bad. Like you think it's terrifying for them and for the family. And uh, a few months later, as you said, they're 70% better. They're walking, they're talking. And in fact, one of the reasons I became so interested in neuroscience was because when I was a child, my grandmother had a stroke, and she lost the ability to talk. She couldn't move um, her left side of her body. But within a few months, she was moving the left side of her, I'm sorry, the right side of her body. She was moving the right side of her body again. And so, yeah, so I think um, the yoga part of it, we don't know how much yoga helps with recovery from stroke. Theoretically, it definitely could. But what we do know is just doing things after and not giving up is really what helps people get better. So specifically for stroke, That's what I can say there. And then for kind of helping people recover, there's a lot of thoughts about how yoga might impact neuroplasticity, especially if it improves mindset and mood. So, in order for people to recover, you can imagine they have to be in kind of the spirit to recover, in a good mood to recover. So, if they're depressed, if they're not motivated, that's going to really limit their ability to participate and get better. And so that's actually the area where yoga is, I would estimate, like without seeing a study directly, like that's where yoga would be most helpful, is helping people with the mood symptoms that come after stroke, reducing their depression, reducing their anxiety, making it easier for them to sleep, and all of that together supporting their brain as they recover.
Correct me if I'm saying this incorrectly out here, but I believe sleep is the most essential part in any, ailments recovery, be it any brain injury or any form of ailment out there for that matter. So now somebody suffering from a brain injury, what form of yoga, asanas, or pranayamas are suggested for that person?
Yeah, this is a great question. And there's so many different ways to ask this question, which is like essentially, what are the necessary and sufficient components of yoga? What do I have to do in order to get the benefits? And I don't, I think there may be an answer to this question, but I don't think anyone really knows it. So a lot of what it comes down to right now is the personal expertise of each individual teacher. Teachers have worked with many students. They kind of develop a sense of what works and what doesn't. But in terms of studies, if you look across all the studies done on yoga, there's about 8,500. I haven't read all of them, but I've read a good number. And the whole thing is, you have some studies that are Kundalini, you have some studies that are Ashtanga, you have some studies that are Sundarshan Kriya Yoga, you have some studies that everything. There's laughter yoga, there's goat yoga, like there's just so many things that have been tried, and they all seem to work. And I think it really comes down to is that mindful awareness that people develop as they do postures that improves their interoception. And then also practices like breathing, meditation, ethical rules, personal observances. And those are what really lead to that uh, increased state of consciousness and awareness. And then ultimately all the other benefits like improve sleep. And then, like you said, if you improve sleep, you're going to improve so many other things too, like memory, thinking, recovery, all of that. So that's kind of the way I think about it right now. There's been very few direct head-to-head comparisons. Like, what if we compare doing this type of yoga and these postures to this type of yoga and these postures? But those studies, when they do head-to-head comparisons, they seem equivalent, meaning that as long as you do yoga, as long as you do mindful, sustained postures, breathing exercises, meditation, relaxation, that's what seems to have the effects. And whether you're doing, like the advanced versions of the postures or easier variations of the postures, it seems to work.
Help me understand, Jonathan, one thing. Since you belong from the modern science background, that's your primary profession. Why is it that a lot of people with the modern science background negate the benefits of yoga? Like the other day, I was at a physiotherapy center, and the patients were telling the physiotherapist that we tried yoga. She was somewhere or the other, neglecting the benefits. Now, I understand the approach in modern science and yoga might be different, and she was very vocal also about that. But in a manner, it was, I see that frustration at times, with doctors that why are you coming to us if you have to do yoga?
Yeah.
So, why that sort of, resistance towards yoga
Yeah.
is always there?
That's a great question. And I truthfully don't know. Um, I have some suspicions. So one is that, and I can tell this from like a personal experience because I had something like this, something that I remember. Um, sorry, it's not personal experience. It didn't happen to me, but it's it was very like impactful when it happened. So I think everyone might know who Steve Jobs is. He was the founder of Apple. And when I was a child, he passed away, and he was diagnosed with pancreatic cancer. And this isn't specific to yoga, but he was diagnosed with pancreatic cancer and refused medical treatment. He actually preferred to kind of go like a holistic and natural approach to treatment. And so he was drinking green juices, trying cleansing activities, things like that. And he ultimately died. And it was kind of recognized that had he done medical intervention and surgical intervention earlier, he would have at least lived longer, if not survived. And so I think really the takeaway message for a lot of people in medicine from something like that is these alternative, or however we want to call them, complementary practices can be harmful when they take people away from medical and surgical interventions. And so I think it really comes from fear that people will end up hurting themselves or their family members if they pull people away from medical and surgical things. And that's why I think it's like what you said. It's like they're not meant to be opposites. They're meant to work together. Um, there's actually research that, there's this researcher in Houston, Texas, Lorenzo Cohen, and he studies cancer quite a bit. He's published a lot on cancer, and he's starting to show that for people who, obviously, we know that chemotherapy surgery prolongs people's lives when they have cancer. Well, he's showing that if they do yoga on top of that, that prolongs their life further, right? So there's preliminary evidence for that. And so it's really, they go together, they go hand in hand. And I think when that's the message, it's so much easier to accept it rather than feeling like it's going to be something that pulls people away from treatments that are proven.
Wow, wow. That's a really amazing perspective that's coming out about yoga and the level of research that's been happening in the US out there around yoga. A lot of these things really don't come out open in the public, and the general public is not even aware of. So again, that resistance from the regular doctors, and not again, one thing I would like to put across is, as you shared about the story of Steve Jobs. Now, be it modern science or the alternative therapies, howsoever we want to call them, if the guidance is not right, the end result can be different than what we expect in either of the areas.
Right.
Now, there have been a lot of cases in modern science and as well where the neglect by doctor, or I would not say the neglect might not be the right word, but because of some, I'm not getting the right word over here. There have been cases where the patients have died,
Yeah.
though the doctor tried his or her best out there, and still the patient didn't have the likely outcome.
Yeah.
Now, that didn't stop people from accepting modern science. We have
Yeah.
seen more and more hospitals mushrooming. The place where I live right now, I have seen over probably 10 hospitals, opening up with a full-fledged multi-specialty hospitals in last 6 years alone.
Yeah.
So while we do hear cases where patient families and friends and families have created a ruckus because the outcome was not as per their will, but still modern science is the go-to, science for any form of cure out there. So why a single scenario is, cornered and made an example out of?
Yeah. That's a really good question. And I think um, so one way to look at this is like why would we trust medicine when we hear like all these stories of horrible outcomes happening? And there's no doubt about it. Like, surgery is risky, right? Surgery is always risky. There are so many ways that surgery has become less risky over time. But a 1% risk is still a 1% risk. And I think one of the reasons that we still believe in it is because there's study and evidence about that risk. So we know what the risk is. We can inform people about it. And then at the same time, do things to prevent that risk. So then when we compare that to, I'm not comparing it to yoga right now, but let's say we compare it to something like, I don't know, like ayahuasca ceremonies or other things that people are pursuing, we don't actually know the full risks of that. That has not been studied fully. So it kind of loses trust when it hasn't been studied, and you can't really point to the evidence and say, this is the risk if you choose this option. Now, with yoga, I will say there's been a ton of study about the risk of yoga, and it's incredibly low. And this is one of the reasons that I feel really confident, strongly advocating for yoga, is that even if people, choose to do yoga and it doesn't have as much benefit as we're hoping, it's not going to cause much harm. And that's a really important thing to tell people about, right? So how do I know it's not going to cause much harm? I will say there are some really horrible case reports published about yoga where people have suffered really bad injuries, but those are exceedingly rare. And if you look at the randomized controlled trials on yoga, I have seen only one serious injury out of hundreds of randomized control trials I've read. So it's exceedingly rare to develop a permanent disabling injury from yoga. And I think what that tells us is it's worth trying. And the other thing to know is just like in surgery, there are ways to reduce the risks in yoga.
Yeah.
And the main ways to do that are to have credentialed qualified teachers who can understand your conditions and modify the practice for you, doing things in a way that is slow and gentle, not doing things that are kind of like excessively exertional. And so, yeah, I think key point I want to make is uh, we know the risks of yoga and it is quite low.
Wow. And I really, want to highlight the point that you just said that we need to find the right people out there to train us on yoga. Often, just to save few bucks, we go out with inexperienced people who claim to be yoga teachers or yoga gurus. And then when we have side effects, we blame the modality, not our actions out there. So I really appreciate and thank you for bringing out this point. Um, I would like to understand from a mental health perspective, I do understand that pranayama can help ease the stress and anxiety a patient suffering from cancer. But what are the other benefits we can see? Because you mentioned that there are 4 points which have been mentioned, by the US out there to support yoga, which supports, the treatment through yoga, back pain, cancer, migraine, and food disorders. So if you can highlight a little bit on the cancer, because for the other 3 points, I can relate to it. I have cured my backache using, yoga. I have migraines since childhood, and yoga and Ayurveda have really come to my rescue. And currently, I am going through a phase where I am not doing mindful eating. So I have gone back to pranayama to start doing mindful eating, and it
Yeah.
has helped me. So I've just had 3 classes with my yoga teacher, and within 3 classes, I can see a good shift where now I am able to make out when I'm having unconscious eating and conscious eating. So that difference, which was starting to fade in, I'm again able to make that. So
Yeah,
that's helping me. But yeah, with cancer, if you can just highlight on that.
definitely. So the guidelines on cancer do not have to do with um, prolonging people's lives or anything like that. So the evidence for prolonging people's lives with yoga who have, sorry, prolonging people who have cancer's lives with yoga is not there yet. It's only preliminary. But what it is evidenced to help with is pain from cancer, mood symptoms from cancer, so like depression and anxiety, sleep for patients with cancer, and also quality of life. And so you can see how all of those are very related. And, you know, I think those are the experiences of everyone who practices yoga. I think most people who practice yoga, you go into any yoga class and you ask people, why are you practicing yoga? A very large number of people will say, because it helps me with stress. And that's, you can feel it when you practice it yourself. It helps with stress, it helps with sleep, it helps with mood, it helps with quality of life. So it's the same things that are happening in the cancer patients, but because they are going through such a difficult time, the effects of yoga are really helpful, and so the evidence was very easy to show. Also, it's easier to get funding for cancer research.
Understood. Understood. Um, Bringing out a different perspective, Jonathan, I'd like to understand how can yoga help the families of the patient as well?
Oh, this is such a good question. Okay. So there's actually a good amount of research on this. They call it dyadic yoga. So you have kind of not only the patient, but also their caregiver do yoga. Sometimes they only have the caregiver do yoga. And it has not only an impact on the caregiver's life, but also on the patient's life. And the diseases that I've seen this demonstrated in include cognitive, like dementia, as well as for children, ADHD. So having like the parents of children with ADHD do yoga helps not only the parents but also the child.
Amazing.
So it's really interesting. And those are small, not very strong studies, but I think the idea makes a lot of sense. And as it's, if it's replicated more in the literature, we can really feel more confident about that, you know, in diseases where the interpersonal relationships among families affect the disease, having the whole family practice yoga really helps people with the disease.
Got got it. Can you also help shed some light on, the particular pranayama techniques that support cerebral oxygenation and healing after traumatic brain events?
Yeah, it's a tough question to answer. So I'm going to be a little bit, give me a second to think. So there's a whole separate breathing research that isn't necessarily called pranayama, right? So we can kind of learn from that. So if you look at literature on breathing, some of the things that you can take away are that prolonging the exhale is the thing that has the most effect, specifically with regards to increasing the relaxation response. So increasing the parasympathetic nervous system activity, kind of decreasing the cortisol, adrenaline, the kind of fight or flight response. That's the most evidence thing. It's shown over and over again. And in terms of brain networks, this really has to do with the prefrontal cortex, which is goal-oriented reasoning, regulating things like the stress response in the amygdala. So that's really the big picture, but there are many other smaller studies that show other things. So for example, like differences in right nostril versus left nostril breathing, um, differences in cognition with breathing exercises. Uh, and so it's really hard to come up with like a unified what breathing techniques have what effects. Um, I would just say that the most reliable takeaway is prolonging the exhale is going to increase the relaxation response.
Wow, wow. And can you share some of your own experiences with patients or yourself where yoga has been the magic pill?
Yes. So I started practicing yoga as a teenager, and it was it was something I always wanted to do. So I had read a book in high school, that got me really interested in yoga, and I started reading about yoga online. However, I never thought I would find a yoga teacher like I was looking for, like someone who would teach me the philosophy of yoga. I really felt like if I went to a class, it would be very physical, and I wasn't necessarily really. It wasn't even just the physical that I didn't want. I felt like it would just all be people my mom's age, and I didn't want that. So then I was a runner, and I ended up hurting my ankle running, and so my friend was like, "Why don't we go to yoga?" And I was like, you know what? I've always wanted to. Let's do that. So I went to yoga. I not only was everyone my mom's age, but it was hot yoga, so they were actually all in bathing suits as well. So I was like, I don't know if this is for me, but I kept going, and my ankle got so much better, and really interesting things happened where. I noticed that I went from being kind of a slow runner to the fastest runner on my team. I became so much more calm. My sleep was better. I was really focused. I just kind of had this experience of like I was a better version of myself. And that's when I got hooked and got really interested in yoga. I went every day for years. Um, and so the other thing that I find really interesting now is I don't do asana or breathing as much as I used to, but I think the effects have been permanent. Like, uh, doing it at that age, I think created a lasting effect on the way that I work, the way I respond to things, my attitudes, my mood. So yeah, my personal experience is very strongly advocating for yoga.
Amazing, amazing. Um, are there any evidences or studies that you can share where meditation has really helped with post-concussion syndrome symptoms?
Yeah, so this is actually a huge focus of the Neuroscience and Yoga Conference this year. So one of the topics is yoga and brain injury, and which includes concussion. And This isn't an area that has a ton of studies published, but enough that there are a couple of randomized controlled trials, which is a very good level of study, and then also meta-analyses, which is another good level of study. And really what it shows is it's not the studies, some of them are meditation, some of them are very like mindful postures. But another key aspect is really sangha, like having community and people to go through the experience with. And so uh, the effects are good. They help, again, as we saw with cancer, with mood and sleep and quality of life, and people recover their function and their ability to resume work and things like that faster. So, yeah, I think for concussion, yoga is a really promising area. And that's great because concussion is extremely common and there's no medical interventions that really help with concussion right now. Usually for concussion, what you do in the medical world is just try to help people with their symptoms. So if they have headaches from the concussion, you try to make the headaches better. If they have pain, you try to help with, the pain somewhere else. Yeah, so it's a really nice lifestyle intervention that's needed by that population.
Jonathan, let's also reflect upon the endocrine health, where we talk about the hormones and the glands. Because if we are looking at inducing relaxation by elongating our exhalation, somewhere or the other, I believe hormones have a role to play in that, where hormones are getting activated or they are being better modulated by the glands. So, if you can just shed some light on how yoga really improves our overall endocrine health out there.
Absolutely. And I really think of the endocrine system as, if not part of, at least super connected with the nervous system, because it's really the brain that controls all of these glands. And it does it by using other hormones to control the glands that make the main hormones. And so there are a few areas where yoga has been studied. I think the most important and evidenced one is stress, believe it or not. Actually, I'm sure everyone does believe it. And so uh, there have been many studies looking at the changes in cortisol with yoga interventions. And suffice it to say that yoga really reduces cortisol. So basically a marker of stress. It makes it look like the body has less stress. But more than that, it is reflective of better stress regulation. So people are able to generate stress responses when they need it, perform well when they need to, but then also go back to relaxation and recover. And so we see the cortisol system like actually working, what's the right word? Like in a more regulated way, like working the way it's supposed to, kind of. And so that really may be the way that yoga helps with the rest of the endocrine system as well, is by affecting how stress works, because stress affects so many other things. But some other areas that have been well researched include metabolism. So, of course, the brain and hormones are going to control how digestion is working, how energy is used, blood sugar, things like that. And many, many people in the world have diabetes, right? It's super common. And so, understanding how yoga affects diabetes and insulin and glucagon and all of the hormones that regulate blood sugar is super important for helping these people with diabetes. And there's more and more research coming out that yoga helps improve glucose metabolism and regulates insulin sensitivity so that people are with diabetes are able to have better functioning of their cells. So, yeah, go ahead.
Yeah. So can you elaborate on this? Because this is something, I would really like people to be aware about. A lot of people feel that diabetes cannot be cured by yoga or cannot be managed by yoga. So you can just, shed some light on the research that have come out.
Yeah, this is really important. So, you use the word cure, which normally I'm very hesitant to say, right? Curing is a very strong term. It means that the disease will never come back. It is fixed permanently. However, in diabetes, it is possible to quote unquote cure. You know, it takes permanent lifestyle change, but that permanent lifestyle change can cause a complete remission of diabetes. Now, that person is still at risk of developing diabetes again in the future, don't get me wrong. But in terms of a yoga intervention, what's so amazing about yoga is we're talking about as the postures, the breathing, the meditation. That's what we're really focusing on. But it's a whole lifestyle. People usually change how they're eating. As you said, you become more mindful of how you're eating. People may end up becoming more vegetarian, eating more vegetables, eating healthier foods. All of that is going to affect diabetes. And so the main studies on yoga specifically for diabetes are including the postures, the breathing, meditation, relaxation, but we can't ignore that, all lifestyle changes affect diabetes. Diabetes is a lifestyle disease. And so the management of diabetes with yoga, uh, really what it does is so if you think about diabetes type 2, which is the most common type, is the result of cells becoming resistant to insulin. So insulin is trying to communicate to the cells, open your channels, open your gates, let the glucose in, but the cells stop responding to it. And why does that happen? There are a few reasons. One is they get really sick of doing it, like they do it too much, right? There's so much sugar that they just get sick of doing it. And then another reason is actually a buildup of fats blocks them from being able to open the channels. And so the way that yoga might help this is one is by improving stress. So stress actually makes cells more resistant to insulin. Because if you think about it, when you're stressed, you want the sugar in your blood so that specific organs can use it. So the stress is kind of telling the rest of the body, don't use the sugar. We need it for important stuff. Whereas if there's less stress, now all the cells are kind of more free to take up the sugar. And so blood sugar is going to go down. But another way that yoga might work is the muscles might become better at using the sugar. They might become either, bigger muscles or more use of the energy by those muscles. And so now, just like any other form of exercise, the insulin sensitivity is going to go up, and you're going to have less sugar in the blood. And then a few other things that might make an impact, like we were talking about before, is improved sleep. Um, One of the big triggers for excessive eating, of course, is mood. So by improving mood, people might have more regulated eating. Um, and yeah, I'm sure there are more mechanisms. There's an expert on this topic who's from India. His name is Akshay Anand, and he's done most of the research on yoga interventions for diabetes. And I'm hopeful that he'll be able to present at the conference right now. We're just trying to figure it out with his schedule. But yeah, that is the big picture about how yoga could be helpful for managing diabetes.
Can you share a bit about the conference as well? I've been curious. You talked about it in your introduction as well, and you just mentioned it. So, what's the conference about? How can people participate in it?
Yeah, so this is one of my big passion projects. So the Neuroscience and Yoga Conference is uh, it's an event that brings together scientists, yoga students, yoga teachers, researchers from all over the world to share the actual science of how yoga affects the brain and the body so that we can transcend misinformation and improve how we actually practice, teach, and advocate for yoga. And I think everyone knows we live in a time when science misinformation runs rampant, right? It's so easy to find wrong information online. And so I think it's really important to hear from the researchers themselves, the people who are actually conducting the studies, and then I also think it's important to use that information. So, it's one thing to learn. It's super exciting always to learn. But then what do you do with that information? So I think that information really should be applied to improving how we practice yoga, how we teach yoga to specific populations. So maybe people with diabetes, people with back pain, people with migraine, how do we teach yoga for them? And then lastly, how do we advocate for yoga? How do we take this knowledge, bring it to a hospital, a school, a prison, and say, I want to teach yoga for this population. I want yoga to be shared with this population. Here's the evidence why. And so that's really the mission of the conference. And every year we have different topics. So this year it's yoga and brain injury, yoga and endocrine health, and yoga and reproductive health. And the dates are April 23rd to the 27th. It's available online or in person. And the mission is really to get this knowledge to everyone. So there are passes anywhere from free, which is an online pass, or to fully upgraded, which is an in-person pass taking place here nearby New York City. And so that's a little bit about the conference. It's one of my favorite things I get to work on. And yeah, I'm happy to talk more about it if you have any other questions.
Surely, surely. Do share about the information. We would love to put it across to our listeners in the description. They can sign up, for the conference from there. And we will also be sharing your contact details. If anybody has anything very specific to ask, they can reach out to you.
Awesome. I appreciate that. Thank you.
Amazing. Jonathan, we talked about diabetes and yoga. There are two more ailments I would like to cover and ask you about. One is menopause, one of the most less understood, phase of a woman's evolution in a journey, and especially the opposite gender does not even have an idea about it when the female counterpart goes through it. So if you can shed some light, what is menopause, and how can yoga really play an important role in easing out that journey?
Yeah. So, just a quick summary of what menopause is. So, around age 50, for most women, usually within 2 years of age 50, there's a change in the way the hormone system works, where the ovaries stop really producing as much estrogen. And so the result is no more reproductive cycle. So for women, they typically have that monthly menstrual cycle where there's a shift, a very specific pattern of hormone fluctuations, and that goes away. And with that change, the entire body has changes. So not only does this change things like, um, obviously reproductive function, so women no longer reproduce after that age or after menopause, but also it affects things like cognition. Sometimes people refer to menopause brain. It affects sleep. It affects how well they're able to sleep. It affects their thermoregulation, so their ability to regulate their temperature. And this is what's known as hot flashes. So often, I forget the percentage, but I think it's something like 60 or 70% of women will experience this episodic excessive heat where they just feel really hot and will sweat a lot, and then it goes away. Um, there are other symptoms like changes in metabolism. So that usually there's a change in how fat is deposited throughout the body. There are changes in the skin, the hair, the nails. So this is really a change in hormones that affects the whole body and the brain. And so this topic of menopause is really interesting. And there are, medical interventions that really help. I think the biggest one that people will be familiar with is hormone replacement therapy. So if the problem is that the ovaries are no longer making the hormones that keep the body, functioning the way it was before, just replace those hormones. And that really helps to alleviate symptoms. So that's a very common route that people will take. However, there are decent number of studies showing that yoga can actually reduce, not cure, but help manage the symptoms of menopause. So it helps with cognition, it helps with sleep, it reduces the hot flashes, and multiple more things like that. Of course, it's not going to, bring back reproduction, change the hormone levels dramatically, but it really helps with the symptoms.
Another ailment I would like to cover is PCOS. And if whatever understanding I have is a lot of the triggers around PCOS are because of the stress, if I'm not wrong. Or stress is one of the contributing factors amongst many. So if you can just shed some light on that and the role of yoga.
Yeah, absolutely. So PCOS, polycystic ovarian syndrome, the name doesn't really capture what it is. So, one of the key diagnostic features is that there are multiple cysts on the ovaries when you take an ultrasound of them. But that doesn't describe what the experience of PCOS is or what it's actually like. So with PCOS, it's the changes in the ovaries. It usually happens when people are younger. It starts maybe in the teenage years, the 20s. But the changes in the ovaries with the multiple cysts is related to hormone changes. And so it's really a hormonal disease. And it has two parts to it. One is a part that affects the female hormones, and another part is what affects what we were talking about before, the hormones that regulate sugar. And so some of the core features of polycystic ovarian syndrome is that people are insulin resistant. They almost look like they're developing diabetes, but they also have changes in fertility, so less fertility, and changes in the female hormones that actually makes their body sometimes even become more male. So they might grow facial hair, they might have, you know, different things like that, changes in their menstrual cycle. And so that's an overview of PCOS. There's more to it, but yoga has been applied as and studied as an intervention for PCOS. There's a meta-analysis from a researcher also in India, Anita Verma, and she's presenting at the conference about her work on this topic. And basically, again, same kind of message, just to boil it down to the main point, is that yoga is not a cure, but it definitely helps with the insulin sensitivity and some of the kind of more annoying parts of the disease. And it's also going to, of course, help with quality of life and mood and sleep.
Amazing, amazing. Wow. I never knew myself that there are so many benefits to yoga and so many different perspectives to it. I was, thanks for widening my horizon of understanding of yoga. Uh, you brought out an important point about fertility, and that's becoming one of the major concerns of the young couples in today's age, where because of stress, work-life imbalance out there, they are not finding time for each other. And then, yes, the body clocks are ticking at a very alarming rate. So, if we have to talk in general, very specific to the fertility and the reproductive health, how does yoga really play an important role?
Yeah, this is a really, really good question. I have a lot of thoughts about this, and I just spoke with a researcher from India, Rima Dada, who is going to be presenting her work on fertility at the conference as well. So it, it's a really interesting topic. Uh, so many people think that if there's trouble for a couple to conceive, you know, to get pregnant, that it's a problem with the woman's body, like the female physiology. But actually, equally, if not more, it can be a problem with the man's body, so with the sperm production. And so Rima Dada has done a lot of work looking at sperm function and trying yoga interventions to improve it. And she's shown it not only in terms of looking at the cells, seeing how they're working, but also the molecular markers of those cells and even the clinical outcomes, so the ability to conceive. And so there's actually some evidence, yeah, that yoga results in a modest improvement in fertility for men, and then for women, the evidence is not as strong, but it's starting to come out. But if you think about it from a theoretical perspective, for women, they lose fertility as they age much more than men do. So around age 35, a woman's fertility really starts to decline. And one of the big areas that yoga is studied for is for changing aging, like modifying the course of aging. And what that really means is changing the cellular markers, changing the cell function, changing the way, the health of the genetic code, so that cells can live longer and not appear as old. And it makes sense then that if yoga is having these effects on aging, that for a woman where age has such a big effect on fertility, that yoga could kind of prolong the fertile period for a woman. That's more conjecture and speculation, so please don't take that to mean that, the evidence is there already, but it's accumulating, and so it may just be a matter of time before yoga is included in the guidelines for fertility. We don't know.
Understood.
Um, yeah, but then the other thing with it is in terms of pregnancy, so prenatal yoga has actually really been shown to improve outcomes, meaning that women who do prenatal yoga are more likely to have a healthy, normal vaginal delivery rather than having C-sections or complications or things like that. And then it also helps in the postpartum period with postpartum depression, mood, and like being able to take care of the baby. So, both at the level of conceiving the baby and then also at the level of giving birth to the baby, yoga seems to have an effect.
Wow. Um, can yoga also help in better regulation of the menstrual cycle out there?
Great question. For PCOS, definitely. That was the work that I was talking about before. And then for other people who don't necessarily have PCOS, I don't think it's been studied as much. One thing it can help with is pain with menstrual cycles. So some of the discomfort, cramping, bloating, it can definitely have an effect on that. And then for other conditions like endometriosis, which is a condition where there's uterine tissue outside where it's supposed to be, and so there's kind of uh, discomfort and pain from the cycle affecting this tissue. Let's say it's in the abdomen or somewhere else. And so yoga can also help with that a bit.
Any specific, suggestions you would have for the males out there to improve their reproductive health with the help of yoga?
So I don't have specific practices. We could look at some of the studies Rima Dada did and see what specific postures and everything they were doing and of course replicate that. But the main point is I bet they were just doing yoga. I don't know for sure, right? But I bet they were doing some sun salutations, some seated postures, some standing postures, back bends, forward bends, spinal twists, relaxation at the end, breathing, meditation, right? Just the basic components of a yoga class. And so I think if anyone were to replicate that, it would kind of be the same thing. Um, the in terms of like how much of an effect to expect, this isn't something like, let's say someone's cause of infertility is actually that they had um, malformation of the tubes. Like there's a disconnection between the where the sperm are produced and where they come out. Uh, that yoga is not going to work for that, right? So of course it depends on the cause, but for the more lifestyle driven infertility, so for people who are having trouble with fertility because their lifestyle is unhealthy, they're very sedentary, they're eating badly, their sleep is bad, they have a lot of oxidative stress in the testicles, then yeah, yoga might really be helpful for that.
Jonathan, any final message you would like to share with our audience about yoga and its benefits?
So I have this favorite study. It was looking at anxiety in people who are older, so people above the age of 65, and they compared yoga to doing cognitive behavioral therapy, which is a gold standard, helpful intervention for people with anxiety. And they did something really unique in this study where they either forced people to do yoga or CBT, so they didn't get to choose which one they did, or they let people do whichever one they preferred. So if you preferred yoga, you could do yoga. If you preferred cognitive behavioral therapy, you could do cognitive behavioral therapy. And which do you think worked better? Like, do you think yoga works better if you want to do it or if you're forced to do it?
It's the former one if you want to do it.
Yeah, most people would say if you want to do yoga, of course it's going to work better. And that's not what they found. It was the same. And so, we don't know if the people who were forced to do yoga ended up liking it, but I think the key point here is that, a lot of people might feel hesitation about doing yoga, not want to do it, even like I did when I was a teenager. But really, when you start doing it, the effects are the same, regardless of whether you want to or not. So I think, with all of the different health conditions that it helps with, and really the main things that it helps with being like sleep and mood and cognitive function, I think all of that together is really evidence that it's a lifestyle practice meant for everyone with low risks. So I'm a huge proponent of yoga. And yeah, I love the science of studying how yoga has these effects and to what extent. So I really look forward to anyone who wants to reach out. I love talking about this stuff. So yeah, thank you for giving me another opportunity to discuss this. And thank you for all the awesome questions. And I had a great time.
Same here, Jonathan. Same here. Thanks a lot for bringing such a wide perspective to yoga. Being from India, for me, I didn't know so much about yoga and the level of research it has reached. So thanks a lot for, sharing that knowledge and wisdom with me. Really, really appreciate it.
Likewise, thank you.
And listeners, today we explored how integrating yoga with modern medicine offers a holistic approach to healing and prevention. We encourage you to reflect on your wellness journey. If you have concerns, stressors, or health challenges you would like to share, please visit our anonymous mental health platform. Link is in the description. And if you have any queries about the yoga yoga and neuroscience conference, you can reach out to Jonathan. His details would be in the description below. Until next time, please stay tuned and remember, we are listening.